A healthy smile is a happy smile. Our teeth are important for so many things. We use them to chew our food, talk to our friends, and smile for pictures. Just like we take care of our bodies, we need to take care of our teeth too. Sometimes our teeth can develop little holes called cavities. Cavities happen when we eat sugary foods and don't brush our teeth well. It's like when we leave a plate dirty for too long and food gets stuck on it. Don't worry though, cavities are very common and dentists can fix them easily. Visiting the dentist might seem a little scary, but it's just like visiting a friend who helps keep our teeth healthy and strong. Think of it like this. If you were building a tower with blocks and one block had a crack, you'd want to fix it before the whole tower falls, right? That's what getting a filling is like, fixing the crack in our tooth before it gets bigger. In the following sections, we will walk through each step of getting a cavity filled. When you visit the dentist for a checkup, the first thing they'll do is take a close look at your teeth. Think of it like a detective searching for clues. The dentist uses a tiny mirror to see all the nooks and crannies of your teeth. To get a really good look, the dentist might take x-rays of your teeth. These x-rays are like special pictures that show what's going on inside our teeth. They help the dentist see any hidden cavities that might be lurking beneath the surface. This thorough examination helps the dentist figure out if you have any cavities and, if so, how big they are. Don't worry, they'll explain everything they're doing and answer any questions you might have. You might be wondering if getting a filling hurts. The good news is that dentists use something called anesthesia to make sure you don't feel any pain during the procedure. Before starting the filling, the dentist will numb the area around the tooth with a special gel that tastes a little funny. This gel helps to block the feeling in your gums. Then they'll gently give you a tiny injection to completely numb the area. Think of it like when your foot falls asleep and you can't feel it for a little while. That's kind of what the anesthesia does to your tooth and gums. You'll be awake during the procedure, but you won't feel a thing. Section 4. Out with the bad decay removal. Once the anesthesia has taken effect, the dentist will gently clean away the decayed part of your tooth. To do this, they use a special drill that looks like a tiny toothbrush with a spinning tip. The drill helps remove the decayed part of the tooth quickly and efficiently. The dentist will also use other small tools to carefully remove any remaining bacteria or debris. Remember, the anesthetic ensures you won't feel any pain during this process. Just a little bit of pressure or vibration. Section 5. Making a clean sweep cavity preparation. After all the decay is removed, the dentist will clean the area thoroughly to prepare it for the filling. This step is very important because it ensures that the filling material will stick to the tooth properly. Imagine you're putting a bandage on a cut. You'd want to make sure the area is clean and dry so the bandage sticks properly, right? It's the same idea with filling a cavity. The dentist will use special solutions to clean and rinse the area, creating a clean and sterile environment for the filling material. Section 6. Filling the gap. Types of fillings. Now comes the fun part, filling the cavity. Dentists have different types of filling materials to choose from, each with its own advantages. The most common types are composite resin, which is tooth-colored, and amalgam, which is silver-colored. Composite resin fillings are popular because they can be matched to the color of your tooth, making them almost invisible. Amalgam fillings, on the other hand, are very strong and durable, making them a good option for back teeth that do a lot of chewing. Your dentist will help you choose the best filling material based on the location of your cavity and your individual needs. Section 7. Smoothing things over, shaping and polishing. Once the filling material is in place, the dentist will shape and polish it to make sure it fits perfectly in your bite. They will ask you to bite down a few times to check that the filling feels comfortable and natural. This step is like sanding down a piece of wood to make it smooth. The dentist uses special tools to smooth out any rough edges and ensure that the filling feels just like a natural part of your tooth. You won't even realize it's there.